Hi, here we are at ASH in San Diego, and we presented data about the role of MRD in patients with elderly AML treated either with semi-intensive therapy or hypomethylating agent, azacitidine, in a randomized phase 3 Spanish PETHEMA clinical trial. The role of MRD has been thus far poorly investigated in elderly AML, particularly in patients being treated with hypomethylating agents. So here we believe we provide novel data showing that yet unfortunately only a few patients achieving CR are also able to achieve a negative MRD status. The rates were 20% negative MRD, 80% positive MRD among patients in CR. However, we did show that the cumulative incidence of relapse as well as relapse-free and overall survival in these patients were superior to other patients in CR but detectable MRD. In fact, we were able to confirm previous observations in younger AML. Now we confirmed in elderly AML, suggesting that if a patient achieves a morphologic CR but there is detectable MRD, outcomes are very much superimposable as compared to the outcomes of patients in partial remission. We also showed that among patients with detectable MRD, there were no differences in outcomes if patients were treated with fludarabine, cytarabine or azacitidine. And last but not least, and remarkably important I would say, we should recognize that on those few patients achieving undetectable MRD, stopping treatment until progressive disease was really, well, something else should be done to try to maintain the CR negative MRD status in these patients, because we still found a considerable number of relapses on this patient population.